Hi, this is Dr. Stephen Gradwell. Today, what I want to talk to you about is two different worlds. I want to talk to you about the world of pointy-toed shoes and the world without pointy-toed shoes. Now, the first thing that most people do when I start talking about pointy toes is they're thinking, well, you're referring to things like this. I don't ever wear things like that. That's not a pointy-toed shoe. Well, this is a pointy-toed shoe, of course, and believe it or not, this is a pointy-toed shoe. And for you men, you think you don't wear pointy-toed shoes? This is a pointy-toed shoe. These create a lot of problems with the foot. So what I want to talk to you about is it possible that we could be creating problems with shoes? What the current statistics show is that about 70% of the population will have degenerative foot problems such that they'll have to have some kind of attention to it, maybe an orthotic or even surgery. And 30% of the population seems to be unfazed. They don't have as many problems. So what I incorrectly came to in my thinking was that maybe 30% of people could go without shoes and they could do some of the minimalistic things that you're hearing about, minimalistic shoes, minimalistic running, barefoot running, where the rest of the population, the other 70%, could not. Now, incorrectly, I would tell patients, well, you're one of the 30%, you probably could do that, or you're one of the 70%, you're going to need an orthotic. What we've come to understand is when the foot is crammed into the pointy-toed shoe, it can't move and function properly. When it can't move and function properly, the arch will become weak, and we can develop problems such as bunions, metatarsalgia, plantar fasciosis, and tendon problems of the Achilles. So if we want to look at these types of problems in a new way, we have to shed the idea that maybe the shoes aren't part of the problem. So in the pointy-toed world, if we're trying to correct an arch, or maybe metatarsalgia or plantar fasciitis, we're forced to put an orthotic in there to help support the foot. And some of you athletes and people in exercise science have thought, well, why can't you strengthen the arch? Well, you can, but the problem is if the toes are crammed together, then it's really hard to actually activate the muscles. So what we want to do is we want to be able to spread the foot out. Well, to do that, we have to have a different type of shoe. Maybe a shoe that looks a little different. This shoe allows more motion in the toes. This is my shoe, and this is my shoe. I don't wear these anymore, but you can see that that's a lot more narrow. I'm going to put up the other side. These are the same size shoes, if you will, but one crams the foot together and one doesn't. Kind of interesting, isn't it? So we want you to think about is that we have two options when we treat a foot problem, whether it's plantar fasciitis, plantar fasciosis, metatarsalgia, or Achilles. We can either treat you in the world that the pointy-toed shoe is, or we can treat you in a world where we allow the foot to spread. Now, if we will not change our shoes, then we are going to be forced to use therapies, we're going to be forced to use orthotics to treat that. In a world that allows for the foot to spread, where we can reimagine maybe what our footwear look like, then in that world, then we don't need to go with an orthotic, at least not the conventional orthotic you think of. And we'll show you a few examples of how we change that. Okay, I have two different types of shoes on now. The right one is an old running shoe that I used to wear. And you can see when you look at the right one how the toe is more narrow. And you can see the toes of my foot, my right foot, are pulled together more. If I straighten out my toes where they really belong, they should be like this. You can see how my right toe is hanging over the edge of the right shoe. Now if you pay attention to the shoe on the left, the toe box is much wider, allowing my toes to spread. Now I'm not going to cut that one open because I actually do run in this shoe. This shoe is actually a transitional shoe that is more minimalistic, and it allows more spread of the toes than what we see on the right. And you'll notice that what I've done on the right foot is I put a toe spreader in that was designed by Dr. Ray McClanahan, who's a natural sports podiatrist who developed these correct toes type of foot spreaders that we can use to help spread the foot and get the proper toe function. You can see I couldn't even begin to put that in the shoe and utilize the shoe on the right, whereas I can do that on the left foot. When I first started exploring the worlds of minimalism compared to the pointy-toed world, I started paying attention to some of the research that was out there, and that we have muscles that actually will cause the toes to spread. This one is called the abductor hallucis. It sits right in this area here. I had to go back to the anatomy books because when I tried to activate that muscle, I couldn't even activate it. I would try to pull it out and I couldn't do it. And you can see that today I can hold it out there and then I can push it back in. So I can actually do an exercise to see that. If you want to try that at home by just pulling the foot out and then pushing it back in, if you can't even activate it, you have atrophied that muscle and your brain neurologically can't control that. So you really don't even use that. We're finding now that that muscle can be responsible for plantar fasciosis, as it cuts off the blood supply as it goes through that stretched out muscle that is not being activated, and then unopposed by the adductor hallucis muscles. So we can use one of these toe spreaders that Dr. Ray McClanahan invented called Correct Toes. And they just fit right in there in between the toes. Pretty slick little device. And it works in with some of the things that we do to help rehabilitate the foot, whether you have metatarsal pain, plantar fasciosis, heel pain, heel spur pain, even hallucis rigidus, and bunion pain. At first glance, you might think that something like this might be uncomfortable. It really is not, and it certainly isn't as uncomfortable as wearing very constrictive shoes and having foot pain, certainly. What I do find is if I put some of these toe socks, these Injinji toe socks on, they're awesome, and then putting that on top of it is incredibly comfortable. So these are some things that we have to offer. But we have to get into the concept of whether do we want to stay in that pointy-toed world. If we want to stay in that pointy-toed world, then an orthotic is going to be necessary to help support that, because the toes can't actually do what God created them to do. If you're willing to take the step and say, wow, the emperor I think might not have any clothes on, and that maybe shoes are part of the problem, then we can take a look at different types of shoes. We can take a look at different types of orthoses that can help it transition us to those types of shoes, and then further exercises like short foot exercise and eccentric ankle exercises. And then we also can do techniques such as active release technique and adjustments to the foot and mobilizations to the foot to help make that transition. This is Dr. Stephen Gradwell. If you enjoyed this video, remember to like us and to share it. And stay tuned so that you can get all the latest health tips.